and welcome to Public Health Musings. I'm your host, Dr. Caroline Kingori, a public health faculty at Ohio University. I'm so glad you're joining me today for another fantastic episode. This episode is sponsored by Okera Coffee. So why not treat yourself to a delicious cup of coffee while you listen to your favorite podcast? Get premium, freshly roasted coffee beans delivered to your door. Use code SAVE10, one word, for your first order, or SAVE16, one word, for any 3 products for a special offer at checkout. Elevate your coffee experience today. Order at shopokeracoffee.com. That's shopokeracoffee.com, shopokiracoffee.com. shopokiracoffee.com. Today, I'm joined by a fellow Public Health Association member. I met her last year during the annual meeting, and we got to talking a bit about our backgrounds. Little did I know, I would connect with her again via a different avenue and have her on my podcast. I'm very happy to be speaking with you, Hope Rollins, today. And we have a treat for everyone listening and watching the show. So as Director of Education and Training and Equity in Action, EIA Project Lead, Hope provides programmatic and administrative oversight for the event management and continuing education teams that annually develop, produce, and support over 300 plus trainings and virtual education offerings. Wow, that's a lot.
Yeah.
Her work entails cross-center collaboration and fund development, strategic outreach, and promotion. And as the EIA project lead, she leads the planning and execution of operations, external engagement, and public relation activities. She's also held other leadership opportunities as MPHI Anti-Oppression Leadership Executive Team and co-chairs the MPHI Staff of Color Affinity Group, where she focuses on centering and rooting equity and belonging to attract, support, develop, and retain diverse talent, and facilitate human connectedness to foster relationship building, healing, and professional opportunities. So before she went to MPHI in 1999, she worked Detroit at Michigan-based Henry Ford Health System. And she did various things there, and she can talk to us a little bit about that. And also locally, she works with faith-based, community-based organizations on capacity building efforts on a national scale, like I'd said before. She does work with the American Public Health Association as an affiliate representative to the governing council, and this is through the Michigan Public Health Association. And she's an immediate past chair of the APHA Executive Board. Wow, how do you do everything? Everyone, please join me in welcoming Hope to the show. Yay! I am so glad to be talking to you. It was so much fun to talk to you last year at the annual meeting. And wow, look at this. Here we are talking
Small
again.
world. Yes.
Small world. So, as always, I ask my guests to tell me about their journeys. Could you talk to us about your journey to this point and why public health?
You know, it's so interesting because I sort of feel as though public health embraced me. It found me. I was actually on a track of going to medical school, worked in hospitals as a candy striper in Detroit at Grace Hospital, and have always surrounded myself around medicine. So I have relatives that are physicians on my dad's side and have always grown up in that environment. And so I pretty much was on that track, did my undergraduate work at Michigan State University, and was pretty much very engrossed in physiology, all of the wonderful sciences. But I think I got to the point of thinking, am I contributing enough of what I need to be doing? And that was in the midst of me working in a cancer lab with Dr. Sandra Haslam in the Department of Physiology. But I also worked as a departmental assistant as well in the office. So during that sort of tenure time, I sort of feel like it was many years, but did graduate. But after I graduated, I was sort of kind of burnt out and got married, was commuting back and forth, but decided to work at Henry Ford Health System and did a lot of great work there, starting in home care. So very directly connected to patients within their home. ever increasing roles, moved into the office setting, worked on patient access and referral departments, did a little bit of case care management, working with clinic flows and patient surveys and things of that nature. But then, I didn't want to commute anymore, driving hours on end after getting freshly married, and realized, I probably need to find something locally, because we were living in Lansing at the time, but I was still driving back and forth to Detroit. And so an opportunity came up at MPHI as an education training associate. And one interview went well, second interview went well, started literally the next job probably within 3 weeks. And it was just a great opportunity. I come to find out that obviously it was a lot of, disease prevention, health promotion, health education work that was behind the work of doing the public health event management. And so that's what sort of grew my passion of, there's a way to impact families by working on the other end of doing health awareness, literacy, things of that nature. So I just grew to love it. And NPHI is a wonderful place to work. So it really embraced me, but always had this passion to go into medicine.
That's awesome. I get to hear that a lot. I've had probably 3 to 4 guests here.
Oh, wow.
Who started on that path, and public health changed their minds,
Yes.
They met public health and they're like, wow, this is it.
This is it.
Yeah. Awesome. So with all that experience that you have, how has the field of public health changed since you first started working in it? And what do you think the future holds for the field in general, but also public health education and training against the grain of COVID, right? And everything that happened.
I know. I feel like I need to start there. Obviously, being very well aware that there were many demographical changes, technological changes that have happened within the nation for decades. But something definitely happened with COVID. And we've had other outbreaks of things in the past. We've had flus, we've had Ebola. I mean, there's been other pandemics, but nothing to the magnitude of this, at least in the time that I've been living, where you are literally sheltered in for many months, years on end. And what do you do in that instance? And so some of the things obviously immediately became apparent is just realizing that those underrepresented populations were even greater impacted. We knew that there were disparities before, but when there is no access at all, when there's multiple barriers, and there were barriers that were already in place, and also structures that were already in place that denied access, denied capacity and access to many different facets of healthcare, it just compounded the situation. And so here we are in the pandemic, and what do you do? As you kind of mentioned in the bio in the beginning, we were doing 300 plus public health events a year, and all of those activities, for the majority of them, I would say about 75% were all in person. So we work with a lot of clients with the state health department, doing various public health topics. We are not the subject matter experts, but rather we work with subject matter experts across the nation, really, not just in the state of Michigan. So we had to obviously make the famous word pivot to move everything to virtual setting. And so one of the things that I have definitely noticed with the change that has happened is us leveraging technology in all aspects, not just broadening the reach, not just doing telemedicine to rural communities, communities that even struggled with internet access, because that's another thing that we had to deal with was the digital divide during the pandemic. But we figured out a way to make it happen. And so now we literally did the shift of all of that technology, all the things that we were doing originally face-to-face, we were able to provide it virtually to a lot of communities and to adult learners. So between technology, COVID impacting us, and just raising the awareness of, wow, we not only had deaths, but now dealing with the racial divide that has happened in society, we were faced to look at our TVs every single day. So listen to the news, seeing the injustice that was happening right in front of us. You couldn't turn away from it because you were sheltered in place. So it really brought a lot of awareness to a lot of issues that had not necessarily laid dormant. The issues have always been there. But in 2020, of stating that racism is a public health factor and it impacts our health outcomes, it's now brought the visibility that it's always needed. So we're now in the throes of doing a lot of that work, even more so at an accelerated rate.
Wow. And it's true. We've seen a shift definitely over time in public health and, the racial issues or just COVID and the miscommunication. So with all this conflicting information available on health and wellness, and knowing that so many people didn't understand public health initially, right? Yeah. And then now they kind of have an idea, but then it's like, what's going on? So how can individuals and communities navigate that landscape to make good informed decisions about their health?
Yeah. And as you stated, I mean, COVID really brought to light a lot of the issues that were there, that were always there. And what I do appreciate is, once upon a time, we talk about technology and internet, and the kids are doing this and that. They're always on the internet. Well, everyone's on the internet. You had no choice but to get on the internet. So one way to help kind of navigate through misinformation, true information is literally, there are components of the internet where you can literally find good factual information. The other thing that we don't give, applause enough to are our local health departments and federally qualified health centers. They are the people on the ground. They are doing the hard work every single day, and they're doing more with less. They're typically underfunded, understaffed. And that's why I think between local health departments, federally qualified health centers, and community health workers, doulas. So, I mean, once upon a time, community health workers, you would hear CHW, but did you really hear it back in the day? It was typically called patient ombudsman, navigators. But community health workers, these are true workers that are working with families. They're working in the homes. They're working outside of the homes. But the key is that they're working within communities. And I think the theme over probably many of the questions that you have for me, my response is always going to be meeting people where they are. Because until we can meet them where they are, that's where we understand the need. That's where we see the barriers. That's where we see the limitations. That's where we see the gaps that need to be filled. And so that navigation that needs to happen, it comes from all of these different sources that are, sure enough, federally funded, state funded. But that is the role of local public health. Their goal is to reduce diseases, to protect us, to ensure the health and safety of all communities. And I think that collaboration with local health departments and federally qualified health centers, working collaboratively with academia, with public health institutes and other faith and community-based institutions, that has helped to bridge a lot of that education out back to the community.
Yeah, I like that perspective. And I don't think we give a lot of credence to this collaborations. And they do get to be technical because we kind of have to understand each other, meet each other halfway. Our timelines are not always the same. But when we're thinking about changes, it's a systematic perspective, systematic view. And so I'm wondering, can you talk a little bit about that importance of collaboration and partnerships in public health and how organizations are working together to address some of these complex health issues?
Dr. Renee Kennedy, who's our CEO at MPHI, longstanding practitioner, longstanding health equity expert in that field. She is an associate professor at MSU, obviously, and she was once the health officer and director at Ingham County Health Department, which is a very large county within the state of Michigan. And what she brought to the table was about the work of health equity. But in addition to that, she talks always about going upstream. We always hear about the upstream, but the thing is not about upstreaming and finding the reason why, what are the roots, but she is focused on getting the upstream as the mainstream of practice, right? So it's not just what has happened, but how did you end up this way? You're diabetic, but what has caused these issues to rise? Is it food deserts? Is it not receiving healthcare in a timely factor. So all of these sort of upstream kind of questions and thinking, it's rooted in making sure that we understand the issues that attribute to those health disparities, right? Because it's not just our zip code, but it's the zip code and also our built environment and what are the other factors that we need to improve our communities. And so what I appreciate is that sort of thinking. But when you think that way, you can't just think that you're the sole source of the provider and can solve the problem. It is a multi-sector collaborative effort that needs to impact systematic structures and systems, policies. So that means your advocacy, that means your trade associations, that means primary health care. All of these collaborative partnerships is what it will take in order to enhance and increase the health outcomes of communities. One of the things that recently happened here in Lansing is the combination, or really the partnership between University of Michigan Medicine, so Michigan Medicine, and acquiring Sparrow Health System. So it's a partnership, and it's a recent partnership. And what I love about it is that you often always hear families that are being referred out to specialties, to specialty physicians that are across, Ann Arbor or in other cities. But yet the goal of that collaboration is that Michigan Medicine wanted to bring the specialty care right here locally to communities. So they're not having to drive. So if there are transportation barriers, you can still receive specialty care locally within your community. Mayo Health Clinic, Clinic Care, they combined with Sparrow Health System back in 2012. So again, that whole need for cancer care is right here locally in Ingham County. So those type of collaboration networks is so critical in enhancing, health outcomes and dealing with public health initiatives.
So this takes me to an additional question. You talked about mainstream and upstream. You talked about an individual comes to a healthcare provider and, they have diabetes, and the healthcare provider says, "What are you eating?" And we're thinking about the food deserts. And therein lies that challenge where we cannot just focus on an individual, right? And often, unbeknownst to us, we say, why can't you control that? Why aren't you eating healthy? Why aren't you just putting on a condom or just stop doing that? Why can't you just say no to drugs?
Right.
And right. So given your experience in both private and public sectors, can you talk about the similarities and differences between public health initiatives and those focused on individual health outcomes against that backdrop of partnerships and collaborations?
Yeah, definitely the partnerships is key, I think, with everything. Just using the examples of how people are approaching public health issues or topics when they're looking at grant funding. Once upon a time, and I would say probably more than 10 years ago, you would have a major university that's applying for funding, and they would be the only entity that's applying for the funding. And if they have a wonderful track record, they would be funded, if it's an ROI or community-based participatory research, just most of those funding opportunities were landed. But during the course of time, which is a blessing, is that foundation, philanthropic institutions as well as federal entities are looking at how collaborative will this project initiative be? It's no longer just a university or a hospital system that's applying, but they have to show that letter of commitment, that partnership that's happening with academia, possibly with a public health association or public health institute, state health departments, local health departments, faith and community-based initiatives, to show this multi-sector approach. It's really all the things that the Institute of Medicine talked about in 2002, the future of public health. They talked about this, is that the way that we can ensure healthier outcomes is if we look at the multi-sector approach. And so now funders are looking more critically at these grant proposals coming in. And me being a grant reviewer, I kind of do that on the side oftentimes. We look at, okay, if they're trying to address food deserts, okay, are they working with urban farmers? Are they looking at rural farmers? Are they looking at trying to build food markets during the summer or spring sessions? And is there a harvest time where they share produce at churches or barbershops, whatever the case may be, during the fall? So how it's, again, meeting people where they are. So if you're looking at advocacy, legislation, you have to bring all of these entities together in order to share an appropriate story, because that human interest story, that's what gets people thinking, right? You think about your own situation, you think about your family members. And when you get to the heart of the matter of things, that's when eyes open. That's when hearts are open. That's when hopefully the wallets will open and appropriate funds that will fund public health infrastructure, because without the funding, all of this is kind of null and void. I'll talk about even mandated reporting training. We recently acquired mandated reporting grant opportunity, and we collaborated with Social Current, collaborated with Michigan State University. And again, you have to show those partnerships. So if you already have an entity that's already working with teachers, already working with mandated reporters, you can gather their research in order to build up the proper curriculum that needs to be taught with an equity lens. SOGI is another example: sexual orientation, gender, identity and expression. Yet again, we don't want to make any assumptions about what populations need. We don't want to make an assumption about what learners need. We want to hear from the target audience. We want to meet them where they are and understand what are the complexities, what are the barriers, all of that, so that we can build a curriculum that's appropriate, so that adult learners will know what needs to be done, so that they can do the outreach and education that needs to happen. So again, you've got to meet people where they are at all levels.
I really like that. And I really enjoy going out and listening to these stories and talking to our communities and, finding the solutions based on them, right? Because it's easy for us to say, oh, the CDC says this. We know what the statistics are and we know what the solution is. And sometimes they don't see that issue as a priority. Mm-hmm. So my follow-up question to you is, what happens when the funder says, okay, I'm going to give you this money for 1 year?
Yeah. Typical foundation funding. Yes. So we want sustainability. Yes.
Mm-hmm. So what do you do with that sustainability plan? You can't change the community in 1 year. So how do you prioritize that? How do you do that? In your role and the people, the collaborations that you have?
Yeah, and that's a very hard question, and that's definitely a challenge, not just for public health institutes that are profits, but essentially you do have to prioritize what your specific aim, what your measurable outcomes are going to be, and in order to get to that, you need to have a good community asset plan. You have to have more discussions, more dialogue, key informant interviews, focus groups to really figure out what are the priority areas. And one of the great things, there's a couple of initiatives that MPHI is involved with, is DASH, so data across sectors for health. And there's another community-based data, pretty much portal, if you will, of all sorts of community data that is able to be acquired in order to do proper programming and planning. And so one of the wonderful things about data, which is, along with technology, there's a ton of data out there, and the sharing of the data is what makes this so powerful. And the first initiative is called DASH, and it is a Robert Wood Johnson Foundation funded. The project is placed at NPHI, but we work very closely with the Illinois Public Health Institute on that initiative. And what that is pretty much a portal or a repository of data that members have access to in order to do the proper planning, education, training, building up initiatives within their own communities. And oftentimes there's not enough funding to do the research, right? So you can't afford to, hire and bring in a PI and do the IRB requirements, all of those things, right? So all of those efforts have already been done, but now you have access to the data in order to do your proper programming. So you're coming in kind of midway. You're not having to do the research, but coming in midway to acquire data that has been appropriately, established, making sure that no PHI, PII is, involved. Everything is perfect, but you're able to use that data to do more data-driven programming planning and strategic initiatives and advocacy efforts. So, the power of data is, I mean, I'm learning stuff every single day. And that's not even my core job at MPHI, but every time I hear about the usage of technology and data mining, it's extraordinary. And I think you'll start to see more and more of that, especially with the rise of artificial intelligence, which that's like a whole nother podcast in itself.
Indeed. And I'm also geeked out about about health and technology, and just recently got involved with that with the population that I'm working with. And I'm just so jazzed. You know, I work with young people on very sensitive topics of reproductive and sexual health, and finding creative ways to give them that information in a culturally appropriate way, but also you're trying to be comprehensive, you know, and address all things in relation to that topic. It's been a very interesting journey, and now we're building a website for this, you know, immigrants and refugee youth, and I'm stoked. I'm just so excited. But yeah, data-informed decision-making is everything. And when it's done collaboratively with our communities, it definitely makes a difference. And I like when the community says, no, that's not what we think is important. This is what's important, you know, and you're like, oh, the timeline is short.
Right.
I don't know how we're going to do this, but we're going to get it done. So you talked a little bit about, you know, COVID, and now moving forward, everything we look at, you know, where health is related, public health, it's with nuance, because obviously COVID-19 has really changed a lot. So what lessons can we learn about the importance of public health preparedness and response efforts?
Yes. Well, I think more than anything, because of the outcomes of COVID, it raises the awareness of health equity. And health equity is not about equality. It's about, number one, being aware of the systemic structures and systems that have always been in place, but then actively being proactive to address those barriers and eliminate the barriers so that people can obtain their optimal health. So it's not a one and done. It's not a checkbox. It is truly a process. And I think with that process, it provides opportunities for education, for learning, for awareness, for legislation, drilling in the importance of the Affordable Care Act so people have access to insurance, but also training and coaching and building up a workforce that is prepared to address the needs of our communities. And I think beyond meeting people where they are, the other huge public health initiative is workforce development. And it's not just workforce development that's just, you know, soft skill only professional development. This is professional development that has a true equity lens. And that's one of the things that I'm very proud of that MPHI is doing right now with the Equity in Action workshop series. So we're not only level setting what health equity is, you know, core concepts, we have a training that's focused on that. We also look at engaging communities and working with communities through an equity lens. So being culturally responsive based on, again, where people are. It's doing quality improvement efforts and looking at, you know, the PDSA cycle, but doing that even with an equity lens. And then just knowing how to facilitate and doing collaboration with communities. You know, often people are wanting to make a change. They're wanting to do a change. But again, if you don't understand the populations or even have an awareness or empathy to the populations that you're seeking to have conversation and dialogue with, there's a talent with that. That's a skill set that needs to be acquired. So group facilitation and creating relation-based dialogue. So those are kind of the workshop series topics, and we're working very strategically to get the word out so that we can help to educate the public health workforce that's current now. But the other huge initiative that needs to happen is workforce development pipelines that need to be developed, not just in college, not in high school, but you have to tap into that curiosity that happens through K through 3, K through 6th grade, middle school. Tapping that in and creating opportunities where students can be mentored or coached or work alongside with other practitioners, being in academia, primary care, public health institutes, local health departments. It doesn't matter what venue it is, but the thing is that you want to kind of prick that curiosity and get them excited about STEM stuff, just STEM work, STEM efforts that are happening. So that's one of the other initiatives that we're working very hard within NPHI as well, is workforce development. And so one of the other grant opportunities that we're working with right now is with the National Network of Public Health Institutes. We're considered one of the hubs that's working with other local health departments on pretty much being an entity to provide technical assistance. So depending on what they need, if it's equity training, if it's doing evaluation through a culturally responsive lens, if it's facilitation, survey, data mining, all of those kind of efforts, NPHI as well as other partners are serving as a technical assistance hub for them. So again, we're focused on the training and coaching that needs to happen, not just at a professional level, but we want to do it at all levels of learning.
Oh, wow. I have seen a need definitely for workforce training. It's something we're talking about in our public health programs. At OU with the health departments and the trainings and the, accreditation.
Yes.
But you piqued my interest when you talk about K3 through K12.
Yeah.
How does someone get that?
I know. How do you tap into that? So we're still developing some strategies to get to the K through 3, K through 6. And so things may start up as simple as March Reading Month. So March is known as the reading month, going into the schools and not just doing, the Dr. Seuss books, but maybe, doing the cool school bus books, and the teacher in the school books. Of course, I'm forgetting the name of the title of the book right now, but she talks about science. She's a science teacher and just all of these exciting avenues. So talking about science, but then doing the field trips and having opportunities to have them visit and doing field trips at MSU or at out in the field. So understanding environmental health. So there's many opportunities to kind of get into that curiosity a little bit. So we're starting to do a lot of that, the thinking, even at the middle school and high school levels with the NPHI Staff of Color Affinity Group. So that's one of the groups that I co-chair. And we're starting to do just a small little pilot. We're going to be working with a small number of students. It will probably be launched later this year. And we're going to allow them to be sort of matched up and mentored with a public health professional that works at NPHI. But we're going to start sort of at that 9th, 8th grade level, and then we'll start kind of working, a little bit more to the younger years. But some of the beginning work that we're doing right now is just kind of doing the reading months, and then just often doing, how there's like assemblies at the beginning of a Monday, of a week. So having, a public health person come in and talk about, their typical day and have kids ask questions. I mean, it's just a fun time to be able to share what you're doing and telling your story yet again. Just so important.
I really like that emphasis on telling your story. It's something that why I started this podcast, right? Because it might motivate someone to action. It might create an idea, some innovation. So you talked about health disparities, and that word is something we throw out there a lot, right? How can we ensure that public health initiatives are inclusive and do meet our communities where they are in terms of addressing these health disparities?
Yeah, one of the most critical elements that was developed actually in 1994, it was the 10 Essential Public Health Services. In 2020, it was revised. And it was revised. The task force was led by Kay Bender, a wonderful colleague of mine. She's, as you know, she was the past president for APHA, and she used to work at FAB, so Public Health Accreditation Board. But she led the task force and discussions about centering equity in the midst of the 10 public health essential services. And the importance of the essential services is that it provides a framework for local health departments to ensure the safety and wellness of communities. And so by centering equity, it's almost like, okay, we've talked about how we deliver services, but now every aspect of what we do, assessing, that whole full circle of all of the components of the framework, equity is right in the center. So no matter if you're a front desk person that's, acquiring an intake. If you're the medical assistant that's, drawing labs or doing the blood pressure checks, if you have the nurse practitioner coming in and, you're seeing the pregnant mom and ensuring that she's doing her prenatal vitamins and what have you. But all of those aspects is through a cultural responsive lens. And it's also equity at the center. So it not only, it's like rooting the importance of how important it is of having diverse populations. But until it's rooted from all levels of an institution, it's not going to be truly embraced, nor will it ever be practiced. So I think that's critical for some of the work that they did in creating the 10 public essential services with the centering of equity, is that they're expecting it's not just at a medical director or health officer level, it's at all levels of the institution.
So the elephant in the room.
Yeah.
Then what happens in places where diversity is no longer
present?
Yeah.
Yeah. And that's why I will always drill back to, until people can see themselves in a clinic, in a hospital setting, in an office setting, people are not going to feel authentic. They're not going to feel cared for. They're not going to feel the empathy. And that's why that workforce pipeline, and there's a huge underrepresentation of minorities in primary care, academia, professors. So all levels. I mean, you're looking at faculty. Do they look like the people and the communities of which we live? No. And that's why it's so important that as our demographic landscape changes across the nation, doesn't matter what state, it's changing across the nation, there will be more minorities present than whites. So that's just to kind of be quite blunt. So knowing that that's the changing landscape, what are we going to do to ensure that we see ourselves in every aspect of work? And I'm not just talking about the for-profit and the large corporations. We're talking about basic things within the universities. You shouldn't have to go to an HBCU to see an African American or go to an all-female college to see only this gender. I mean, we are working in an environment and in a culture where everyone should be embraced. And I'm not just talking about racial diversity. I'm talking about non-gender. I'm talking about people that need more accessibility, non-binary. I mean, there's so many populations that we need to be doing proper care for. And are we doing due diligence by always having the same type of students accepted into medical school? Are we driving the motivation of underrepresented, marginalized populations to consider science, to consider public health, to consider the harder sciences so that we can see them in the workplace? That's what's going to make the change. It's not the everyday. We need to be what Dr. Kennedy's favorite word is, agitators or disruptors. We need to pose the question. We need to challenge the status quo. And the only way we can do that is really to kind of get into that pipeline, get it early, start the work early, and being very strategic about it so that we can start seeing more diverse populations in very high decision-making roles, because they are the decision makers. They are the legislators. So we need to start making that change. And yes, that is the elephant in the room. And the only way that we can impact that is through workforce development.
Indeed. So when you look ahead and, we look at what has worked and what hasn't worked, what are the biggest challenges and opportunities in public health, and how can we address them? So we've talked about the elephant in the room. Are there any other challenges and opportunities you would like to share with us?
Oh, goodness. Public health funding will always be, we know that is always an issue. And, I'm going to say it again, is that telling the story. I even in my time of, volunteering at APHA and doing the Hill visits, I would be prepared with my WIC information. I would be prepared with my family planning, reproductive health information, my HIV, STI information. And I'm in a good kind of work environment. Well, because we're providing all the training, I have access to all of that data from the subject matter experts that bring all that expertise when they're doing their presentation. So I would do the Hill visits, have my little cheat sheets, have the APHA priorities, and start, drilling away, but not just telling them the hard data and the statistics, but then I would match it with a story. And sometimes these stories will come from my own family. Sometimes the stories will come from families that I know within churches. So the decision makers, they're making the decisions of the appropriations funds. They need to hear what is happening in the community. And it's not as if they're in some ivory tower and they're clueless, but sometimes you need to bring the story to them and just be very down to earth and authentic with that relationship with them. So I think that's the core of many things, is that public health funding. But in addition to that, building these partnerships and not being afraid to build the partnerships is very critical.
So I like how you talked about going to legislators, right? Going up to the Hill, and talking about what's important to the communities, and adding a personal story there. So you're a board member of the Michigan Public Health Association. Mm-hmm. You're a leader at APHA. So what are some of those initiatives you're currently working on, you've worked on to advance public health in the community and beyond?
Yeah, so some of the work, I'm just now coming back to the MPHA board after leaving APHA's chair position, because you're not allowed to kind of do both while you're serving on the executive board. And so coming back, it was nice to kind of bring myself up to speed on some of the initiatives that they're working on. And one of them, oddly enough, is underrepresented populations. And they were working with high school students on a fellowship program. So workforce development, that pipeline is exactly what Ella Green Moulton kind of shared with us. And obviously, she's the current president right now. And so we're looking to kind of resurrect that again and have a cohort of another group of high school students that can go through this fellowship program. I'm hoping to learn a little bit more as we kind of get more involved in it. But in addition to that, we used to have a very strong student section within MPHA. We're looking to revive that, because part of that passion that they have as students is, what can I do? You've got all this energy, you want to mobilize them, you want to give them, a targeted focus, because we want to engage them very quickly. And one of the things that we just recently had a conversation about just last week was, how do we engage our student section and student section members to help us leverage the students within high schools, within middle schools. And so I think, seeing a younger face other than, my age, which I won't say, coming to them and talking about the importance of, STEM and, going into the sciences, it's a little bit more, accepting if you see, someone a little bit younger that can kind of relate. So, having a millennial talk about these things, it's like, oh, yeah, that would be great. So we're trying to leverage really the students. And what I'm hoping that we can do is using MPHA as a pilot, and obviously MPHA is part of Region 5. Region 5 of APHA has always been very progressive in its thinking and its approaches and being very strategic. We want to use them as a pilot, sort of as a model, because we've already done it once, but we want to use it as a model to share with the student section of APHA and potentially the other state affiliates. Because we have, 53 state affiliates or 52 state affiliates within APHA. And so we want to be able to share that model with the other regions. So there's actually a council and affiliates meeting that's coming up very soon, actually this month. I'll be in DC. And so I want to be able to share that story, because what we're finding is that many states are dealing with the same challenges. How do we create a diverse workforce? What do we do with that? And this is yet a great opportunity where we can work collectively across all the state affiliates, as well as the student section of APHA, to make some changes. So there's many opportunities of immersive job internships, again, mentoring and coaching, co-publishing with your PI, poster sessions, all those things that students do. We want the high school students, we want the middle school students to start hearing about these things so that they can get excited, and possibly we'll able to create some scholarship opportunities to bring some high school students to APHA annual meeting. So workforce development, that's my passion point right there.
That's fantastic. Even as it's something we are also thinking about as the chair of HIV/AIDS section. And I find that when we have those meetings with the ISC, the Intersectional
Yeah.
Council,
Yeah.
everyone is wondering, how do we get our students engaged?
Yeah.
Because they have enough energy, they have great ideas.
And you got to get them quickly, Yeah. There.
Yeah, so we are all on that same wavelength as you, trying to see what are those efforts. And I really like that idea, and it's something that I will definitely follow up with you, so that we can also employ that in our section. Yeah. We can employ that maybe in a public health program, and I hope that other people will be able to see it as an innovative process. And I really, really like that. So as we wind down, I just wanted to know, what is your most memorable moment in your work or life to date with everything that you do?
And I'm going to try and talk about this without getting emotional. So outside of workforce development, my other sort of passion is eliminating human trafficking. That has always been a passion area of mine in terms of working with small organizations that are pretty much like a safe house for a lot of women and boys, women and girls and boys and men. So it's all populations. And I think what's also rising is a large trans population that's getting impacted, and a lot of abuse that's happening. So one of the things that has always been memorable, if you will, we in PHI worked on a huge human trafficking initiative. It was a training initiative, but we were partnering with a person that was trafficked many years ago, and she's from the Grand Rapids area. And I came to know her through, she was a speaker for one of our trainings, and we got to know each other a little bit better. And so we built this relationship where not only did we know each other personally, obviously, but what she also did was share her story. And I told her, I said, I really want to document and hear, I want to create like a documentary. Like that's my long range goal, just to kind of share that out there. But what we did was work with a filming studio here in Lansing, and she was able to share the story of how she was vulnerable, how she got into being trafficked, how she was pretty much, held captive, if you will, and shared that story. And we, kind of chunked it out in different segments, and it aligned with the curriculum that we were offering. And it didn't get the leverage, it didn't get the movement that we were hoping for, because at the time, human trafficking, pain management were two of the topic areas that nurses are required to receive every couple of years in the state of Michigan. And I'm sure there's other states that need to do that now. So we were hoping to launch the training even further. But what grew out of that is a greater level of empathy, because I've always worked in reproductive health, doing some of that work at NPHI. But it brought a different nuance of everyone can be vulnerable to this. Even people that need greater access, they have become more victims of human trafficking. So that's always going to be kind of in the back of my mind. I dabble a little bit in the work, but I want to get more engaged in that level of work as well. But just bringing greater awareness to it. There are a lot of issues that came up during COVID, so again, I don't want to get emotional kind of thinking about it, but, when you're sheltered in and you're being human trafficked, So there's a lot of work, a lot of funding, a lot more awareness that needs to happen. Michigan has made great strides in that area, but there's a lot more work to do.
Wow, that's a great way to end this podcast today. Definitely a very sensitive topic. We know the Midwest and the numbers of young people who are trafficked, and it's really, really sad and unfortunate. And I'm glad that you're doing the work to help with that. Just a little bit will help, because it's a lot, and sometimes we feel like we're not. Yeah,
it takes a village. Yep.
Yeah. Sometimes feel like we are not making a difference, but just being able to advocate and talk about it, I think is a good step. So I commend you for that.
You. Thank you. The good
Sort of
light is
passion
that
project.
Yeah, the good ending to that story is that I went with her to Grand Rapids courthouse to get her records expunged. So all of the, drug selling, all of the sex, everything was expunged off of her case. And I was able to see that the same judge that once indicted her for charges was the same judge that expunged everything. And we captured that on video. We were able to take some pictures with her, and it was just a wonderful moment.
Wonderful. So thank you so much, Hope, for joining us today. And I'm definitely going to call on you again and, just do a follow-up and see what else you have going on. I can tell there's a lot there that we didn't even get to talk about. But I'm excited we touched on some of those things. We learned a lot today about what matters and what the lessons learned in public health. And I'm looking forward to speaking with you again. And I just want to thank everyone who's listening and who's watching this today, and just to let them know that public health is a fantastic field. I find it so, it resonates with a lot of us, and so many people can get involved in that,
Everyone.
And so everyone, it's everybody's business, basically.
Everybody's business. Yes. Exactly.
So if they wanted to reach out and talk to you, how can they get in touch with you?
Yeah, they can get in touch with me by visiting www.mphi.org, or just list mphi.org. And if you are interested in the Equity in Action Workshop Series, go again to our main website, mphi.org, and scroll down to the bottom of the homepage, and you'll be able to see the Equity in Action Workshop Series. So we're anxious to be working with all of you all on engaging you in the equity work.
Fantastic. So thank you to everyone for joining us today. Feel free to leave a comment, email us, and let us know your thoughts about today's episode. And we will see you again on another episode.